The South African Medical Association Trade Union has added its voice to the growing concerns over the growing number of unemployed doctors in the country. Hundreds of doctors have completed their community service training and are now appealing to the Department of Health to place them. This week, over 1,800 doctors picketed outside the office of the Eastern Cape Premier, Oscar Mabuyane, demanding to be hired. To discuss this, we're joined by Samatu General Secretary, Dr Cedric Sihlangu. Dr. Sihlangu, very good afternoon to you. Thank you very much for your time. As far as the Minister of Health, Dr Motsoaledi, is concerned, these doctors who have been trained and have done community service are not entitled to be absorbed.
Greetings, Vuyo, and thank you for having us. Indeed, that comment is quite unfortunate from the minister. In fact, it borders on recklessness. You can't have a minister who want to drive the implementation of the NHI, who then on the one corner of the mouth says that the skills which the department has invested on for over 9 years to get a qualified independent medical practitioner, then he comes and says those doctors should go overseas or work in the private sector. We find that very disturbing, unpalatable, and really regrettable. In fact, we go as far as saying perhaps the minister should, in fact, reconsider this statement and retract it, because really you can't, on the one hand, tell the nation that you're moving ahead with implementing the national health insurance, and at this very same breath say that those very skills required to make this NHI functional should go abroad and cause a brain drain from South Africa. That's really unacceptable. Of course, this problem, as you know, Vuyo, is recurring. This is probably the 5th year now. Every year we come and discuss the same thing. That also gives you a picture that government is really failing drastically to plan and put measures in place to ensure that this problem does not recur. I can even go as far as saying there are those who are saying, well, doctors are not special. And I don't think as doctors we seek to be special. But it is the people that we treat that are special. It is those vulnerable babies that we treat that are special, who deserve and have the right to be treated by qualified medical practitioners. So, of course, those who've got private medical aids and subscribe to the medical schemes, it's easy for them because in the private sector, you will get assisted by a specialist, for example, but the poor and the marginalized will not even have access to a generalist, and that's the situation that's untenable.
The minister says, wow, it's not because we don't want to employ these doctors, there's no money to pay them.
So who are we fooling then? Then are we really going to be able to implement this NHI if that comes from the person who's entrusted with the responsibility to ensure that there's adequate human resources for health? When there's no human resources for health strategy, those are the kind of utterances that you will then find. Because we don't expect our leaders to come and want pity from the public. We expect solutions. That's what we expect of you. So it's simply unacceptable. In fact, it's a cause for concern. And it really makes one begin to worry when we, on the one hand, are saying there's no money, therefore we throw our hands in the air, and at the very same breath say doctors must go to private or go overseas. It's a catastrophe.
What do you think is going on here? And I don't want to venture into all sorts of conspiracy theories and the like, because, I mean, the same minister acknowledges that there is a problem. We are unable to service, especially the poor, adequately. And in this country, we have seen people, billions disappearing, from all manner of tenders and other things. I don't know, have you had these discussions among yourself to say, hang on, let's take a step or two back and look at its situation in its entirety and perhaps look at all, even if it means just posing possibilities. What do you think is going on here?
Yeah, look, we've done our diagnosis of the problem, and in our mind, it's quite straightforward. You see, the configuration of the system currently is that those, by and large, those who preside over the public healthcare system or the healthcare system at large, they themselves do not subscribe to this public healthcare system. Meaning, for example, your ministers, your DGs, your heads of departments, your MECs, they've got these very sophisticated medical aids, PARMED, and you name them, where they have access to first world medicine, top of the range type of facilities. When they get treated in these private hospitals, they treated like royalty, in fact. It's a five-star hotel type of setup. So there's no real exigency to solve the problem. I mean, you can drag your feet because the moment your child has a cold, they're going to be seen by a pediatrician, especially for babies. But the average South African, will not have even access to a generalist. So that tells you then, that the pace and the prioritization of resources to deal with this health, problem, those who are in charge of the funds, of the fiscal process and the budgeting, they don't really see this as a big deal. I'm sure the people can get by and suffer another death and yet another death because it doesn't really harm me personally as for example, the authority in the health department, or in fact, even in the National Treasury, because I sit as a Minister of Finance and I've got PARMED. So yeah, I hear this noise in the background, people wanting, to prioritize, health and do adequate budgeting. But for as long as I've got that, PARMED, and that's a sophisticated medical aid, that can be somewhere in the back pocket. And that's the reality. That's what we are faced with.
Do you think we have become, or do you think that as a people, as a nation, we have an appreciation of the decisions that are being taken by the people you have described that get articulated in the manner that the health minister has articulated them, which is where we started with this conversation? Do you think we have an appreciation of what all this means?
I think, by and large, the public might not be grasping the real implications of these utterances that come from the political figureheads. For example, if as you correctly point out, as we started the conversation, if a minister is able to say, well, doctors are free to go overseas, the catastrophe that then stems from that is unspeakable. When you have over 1,000 young doctors, when the government has spent over 9 years of resources training these resources for this country, and then we simply allow them to go overseas and we export skills without actually having any gain for this country, it means that we're going to be going deeper and deeper into a health crisis. We see recently in Gauteng where a mother has died during the process of labor, and there was an uproar. So we'll be seeing more and more of these occurrences, and it's really it's a crisis proportion, and many might not see what this entails in the long run.
If that is the case, there's no appreciation of what saying doctors can go overseas or go private means. How do I reconcile that with the NHI, which we are told is the remedy to all our health ills? In other words, I'm trying to imagine like what must be going on in the minds of the people who say we have to drive the NHI, these are the reasons, and then the same people say we can get rid of, or 400 plus so far, doctors who can't be absorbed, can go overseas. Am I reading too much into it when I say there's a disjunction?
You absolutely. There's a schism. You spot on. And unfortunately, the level of analysis that you've gone through, many might not apply their mind to that extent. But that's the shocking truth about the situation. And we stand very firm in saying, perhaps this NHI is really what we need. And we come with a strong belief that we need to have equality. Everything needs to be equitable, meaning that it should not be about what you can afford, Vuyo, or what the next person cannot afford for you to be able to get access to adequate healthcare. So we are saying you need to keep these doctors in the country. You need to infuse them into the NHI to make it operational. But the notion that says, well, they can go, it's unacceptable, because we need to change the current health system, number one. But number two, we need to keep the skills that we have, because that's what's going to make the healthcare system work, not to shunt it out to the nearest Australia or Canada and so forth. That doesn't make sense to us.
Say we were to give the minister and whoever else, the officials in his department, the big guns, the treasury, the benefit of a doubt. Let's just say we accept what they say, that there's no money to pay these doctors, right? But they would want to keep them or absorb them. What are the possibilities? What can we do?
Let me give you an example, a practical example. When and you remember this acutely, when SAA goes into problems, when airports company South Africa runs into troubles, you know, all these parastatals, we're very quick to find money somewhere and we bail them out, right? Now, very few people actually use, you know, in terms comparatively in the population, a very few people actually fly. Most people will actually use road transport. But we're very quick to put billions in SAA. And similarly, I can give an example of Eskom as well. So when we want to, and when we see some benefit for whichever, you know, minute click, we're able to find billions to bail out, you know, those entities so that they can continue, you know, running. But when it's about bailing out the poor and the marginalized, the gogo from Matatiela, or the young child, you know, from Kutu somewhere, then suddenly there's just no money and we must accept it. We just think that's not acceptable.
But what do you think it is? Have those in power, are they not thinking clearly, or have they just stopped caring for the poor and the marginalized?
The nub of the thing, you know, is precisely what I tried to narrate, is because they are not personally affected. So it is not their child who will have to wait for 6 hours at Bara to be seen when they've been vomiting for the past 2 days, where they're at a risk of losing their lives. So for them, yes, it's an exigency, and yes, it's something that can be dealt with, but it's not personally impacting. Remember, I said those who preside over the system do not subscribe to it, because they're using an alternative system, the private healthcare system. So they sit with the fiscus and they can prioritize what they think is important. So this one that doesn't affect them personally can be put in the back pocket. That's the nub of the thing.
Are you seeing any light at the end of the tunnel?
Well, we're not pessimists, we're optimists. And I would have indicated earlier on that we really do believe that there's some good that we see in the NHI. And we've said perhaps the sooner it gets here, the better, because we understand that we'll then all be in one ship, as it were. And if that ship sinks, we all sink. Because in the current situation, those who are privileged don't have to worry about a failing healthcare system, because, of course, top-tier private healthcare is available for them. So if there's any light we see, is really through this concept of having everyone with equitable access to healthcare.
What have we still not done, or what have we not leveraged on to, for lack of a better description, or I mean, to take this struggle forward and to knock sense into the minds of those who can still do something about it, or even if it's to, if we give them the benefit of a doubt, even if it's to make them see this differently from the way that they have up until now?
I've had the opportunity to engage with the ministers in health even before this one and the one before that. And it's because this has been a recurring problem. And every time we have these engagements, you almost get a sense of some understanding. Where it becomes shocking is that when you then get to this kind of public discourse, the narrative changes. And when we're in boardrooms, we all have the same understanding. And that's pity, because we've really had discussions that seem to suggest that we are together and we know what needs to be done. And we get reassured that high-level discussions are going on at the level of the National Treasury and even at the highest office in the land, the presidency, that no, this will be dealt with the seriousness it deserves and things are going to change. And then you get to the next financial year, then now is the same thing right all over again. And you, like I said, this has now been happening for the past 5 years. So it's very tricky.
Doc, thank you very much for your time. Really appreciate it.